good. So my name is Coreyanne Griffin. I am a licensed independent clinical social worker and a substance use disorder professional, although I'm relying less on that credential lately. I've been a therapist for 16 years. In that time, I've worked almost exclusively with people who identify as female, and I have been specializing in reproductive mental health for 7 years. So that's a basic introduction about me. I'm an integrated therapist at the Providence OBGYN office. So I only see people who are referred to me from within that program currently. So if you're interested in coming to see me, you'd have to be working with the midwives or the obstetricians here at Providence.
Awesome. Well, this particular interview is specifically because many women who go through it's called Fit Me Mama, which is our program to help women who are in the pregnancy and postpartum season sort of thrive. And it's similar actually to centering. We go through different topics, we introduce things, but this interview will most likely be viewed by women who are still pregnant. So this is before postpartum. And my hope and intention for this interview would be to give women an idea of maybe what to expect for that mental postpartum season, and some markers of what might be worth talking to your doctor if you see some things that might be normal that are probably surprising, and then hopefully some strategies to support yourself so you can, again, it's such an amazing season coming home with this baby, but it's a lot, especially on the mental health side.
Definitely. Well, I think one of the biggest pitfalls that people face in the perinatal period is really unrealistic expectations that are created by our cultural norms. So I think it's really important that, to really understand the fact that anything that is that joyful and beautiful is also horrible at the same time. That really, it's a yin and yang situation, that you cannot have that much joy without also having struggle. And so, the expectation and realization of the challenges associated with having babies can really help you navigate that period of time. It's really when you're blindsided by all of that and nobody talked about it and wait, what is this, that women really, really struggle. So I would say, I think I said that struggle is a part of it. What I mean is that pain and challenge is a part of it, and that struggle is what happens when we don't cope well with that. So yeah, I think to start with just the realization and understanding that there's going to be major challenges associated with this huge undertaking that you have entered into of having a baby, and that's okay. That is a normal experience with having a baby and growing a baby. There's a lot going on with that, and so there's going to be a lot of things that are new and surprising that you've never dealt with before, and you can do it. So I don't know if that answered your question.
No, I love the idea that you said that part of the challenge is that we don't really talk about it. We assume that just because it's this, happy occasion, that it should all be happy. And then when we experience those challenges and struggles that are fairly normal when you're adapting, then you feel like something's wrong. You feel a little bit more alone.
Absolutely.
I at least I've had three children. And so one of the things that I remember in terms of struggle in each of those postpartum seasons, one was your body physically underwent something, right? So you have a physical change. So I can remember feeling that hormonal change happening. It was like a wave almost. I could feel things were happening physiologically in my body. And I had that piece. And then you also have this environmental change. I remember feeling like I was out in the world and then I was in this little bubble. And then I also felt like I had the stresses of trying to be a mom and try to manage that. And so I felt like there were 3 different things that really impacted my mental health postpartum.
Yeah, I think that sounds like a really great way of thinking about it. just the fact of the role transition, and that transition happens with every new baby that you have. You know, the first time is maybe a bigger one into motherhood from not being a mother, but after that, adding another child and being the mother of two, and what does this mean to our family unit, and what does this look like now? There are major changes that happen in your role as you add each child into your family. And navigating that role transition is tricky, you know. So recognizing that you have to acknowledge this role transition as a serious change, and come at it with care and attention. You know, anytime you add a new person to your family unit, it changes your family unit, and you get to go through all of the group psychology stages, right? So you go through storming and norming and forming, or I'm sorry, I got that backwards. It's storming and forming, and then norming, and then you get to performing. And then the thing is that not just when you add somebody, but also every new developmental stage that your baby enters, they're a different person. And so again, your family has to reconfigure themselves and figure out, what does this mean, and who are we in relation to this person? And that whole process is very unnerving for human beings. We want to know where our boundaries are. We want to know where we start in other people. And when we don't know that, there's some storming that happens, like trying to frantically feel around and figure out, where do I start and you end, and how does all of this work together? So, you know, finding a way through that is one of the major things that I would recommend for anybody who's having a baby, and recognizing that as an important task in your preparation. And also, you know, you can't prepare for everything, being ready to deal with it as it comes up after you have the baby as well. So there's that. I think when you're pregnant, there's a lot of, again, I really like what you said about hormones. It's interesting to me that we really think of our mental health as separate from our physical health. It is not separate. So you're going through this gigantic physical transformation where you grow a human inside your body, and then you birth that human out of your body. And the hormones involved in that are affecting your brain too, because your brain is inside your body. And so that is going to show up in the way that your mental health is you know, appearing. So I think there's a lot of emotional dysregulation that happens during pregnancy for all of those reasons, both the physical and the environmental that you were talking about, navigating that role transition, figuring out all of these things. You know, in your partnership, suddenly this person that you wanted and loved so much, you need them. And that's a different thing, to need somebody that much to help you with this gigantic task. And sometimes it can feel like it overshadows wanting. And I think that there are some difficulties in partnerships that often come up around having a baby as a result of that as well. Partners often don't realize how much they rely on each other for validation. And then when you don't have anything left to give after you're taking care of a baby, and you're not getting that validation, how does that affect your mental health? And what are you going to do about it? Because you can't ask your partner for that validation, because he or she is busy, right? You guys are taking care of something else right now. So I think all of that is a part of the transition, and, you know, the systems really look at what's going on. And I think that is a really important part of having a healthy perinatal period. I also,
So in the, you know, in the preparation stage, I mean, knowing that you're going to feel some of these stresses and challenges, and that's fairly normal to feel all of this change and adjustment, and that is a part of having a baby in this season. But also going into it, maybe, do you recommend having conversations with your partner about communication and about, like, I mean, I sometimes think that partners are a little bit clueless on this too, and so they're taken off guard when some of this is happening, because they're also not prepared for it.
Totally. And that is why we see that partners have a rate of 1 in 10 of them also have postpartum depression.
I had no idea that was true.
Absolutely. So all of those changes are happening in your family to your partner as well. They just don't have the hormones part.
Mhm. Is there
um,
a way that I mean, it's nice to say like developing communication skills before you have the baby, but how would somebody even do that?
you know, I got to tell you, there's some really great workshops out there. They're kind of pricey, so that's something to keep in mind. But Gottman does a workshop called Bringing Home Baby. This
Mhm.
can be such a powerful workshop to do with your partner to really prepare for that transition, and do the best you can to navigate it as a partnership. I love their stuff, but again, it's pretty pricey to do that. As far as navigating your own internal world and how to, you know, walk through the emotional swings that are just a part of this process, I would say there's really three things that you have to do. You have to take a look at your thoughts and be on top of your thoughts, your behaviors, and your social support, which includes your partner, but is not only your partner. So uh, making sure that you are really navigating all three of that kind of three-legged stool is going to prevent postpartum mood struggles as much as you can.
Hmm. One of the things that we actually talk about a lot inside of the Fit Me Mama program is planning in advance a check-in with someone in your support network. So at least I noticed in my postpartum periods that people want to congratulate you the first few days and then they want to leave you alone. They think you want to be by yourself with the baby for the next 8 weeks, and some of that sets in. And so having someone who maybe is going to reach out to you at 10 days postpartum, whether it's a doula, whether it's an aunt or a friend who you've kind of set up with in advance and just check on you.
Yeah, I think that's great. I also think we don't always know what we're going to want. So you can totally prep for that as much as you want to. And I think that's great. You know, talk to your support system, tell them what you think you will want from them during that period of time. And then, you know, just let them know you might change your mind and be prepared to change your mind. So, you know, I know lots of people who like wanted lots of family around when they first had the baby, and then they had the baby and they felt like they didn't have the time to connect to their baby because all these people were here all the time. They felt bad, like, oh, I can't tell them to go away. So, you know, have the conversation ahead of time. If I tell you I need some time alone with the baby, don't take it personal. You know, that's a thing I heard was something that comes up for people. And, you know, just navigate it as it comes up and let people know what's going on for you and what you need from them. I think, you know, everybody's different and it's okay to not know what this is going to look like for you, especially, you know, you've never done this before. Even if it's not your first child, you've never added this child to your family before.
Mhm.
So we all need different things depending on lots of different factors.
So the prep piece of having good communication with the people in your support, knowing that these changes are coming, but if you're in those moments, this postpartum, what are some strategies where those moments where you cry or you're really mad or you're just overwhelmed or you feel very alone? Do you have some strategies that you suggest for how to, you described it at the beginning, almost like how are you coping with these things? And that's where that struggle comes in, as opposed to just the challenges that you would anticipate would be normal or part of it.
Yeah, I think one of the biggest challenges I see for folks is the need to be in control of what's happening. There is an inherent loss of control in having babies, both in the birthing process and also the parenting process. You cannot control other humans, including your children. And, you know, I feel like there's a primal place that all women have to get to in labor and delivery, no matter how you deliver, where you surrender. And you can do that in a graceful way, or you can be dragged. You know, but there's no other choice. You don't get to be in control.
Mhm.
So I would say the way we think about things makes a huge difference. And if you can go into something knowing at some point you will have to let go and allow yourself to be carried by the river and go wherever the current takes you. And when those times are happening, to breathe in and out and allow them to happen. That happens with our emotions. You know, 80% of people who have babies experience baby blues. which is emotional dysregulation after having a baby. It is not a mood disorder. It's just a thing that happens because of hormones and sleep deprivation. And so you're probably going to cry uncontrollably at some point during this process, and it's okay. Just let yourself. What if you just allowed that to happen, allowed it to move through you, and then let it go when it was over? Like, okay, there it was. You know, I think the meaning we put on it, we feel like, oh, I should be in control. I'm doing something wrong. I'm failing. Or, you know, if I'm out of control, what does that mean? The floodgates are going to open and they're never going to close. So, you know, anxiety is another thing that comes up a lot. I actually want to say something about anxiety. Anxiety is one of the defining factors of postpartum depression versus other kinds of depression. So anxiety is also really a part of the process. And I think the reason for that is that really our human emotions are there to motivate us in life. It's just sometimes they flare in particular ways that actually impede us from participating in life. If we go back to its original meaning, anxiety is there to motivate you to do what needs to be done to take care of the baby. So if you feel anxious, you are going to stay up to all hours and do every single thing that that little helpless baby needs in order to survive. And that is adaptive, right? We needed that in order to make our little human babies that are born so helpless, you know, make it through that first year. So if we can go back and check on what is this motivating me to do, and then implement our problem solving skills to follow through with that, that's helpful. One thing that happens for a lot of women around that is your baby's cry will make you insane, like in a way that it doesn't make anyone else insane. And nobody, you know, I mean, other people might kind of understand, but nobody will get it like you do, right? And so when that baby cries and you just, whoo, right, like that emotion hits you and that anxiety hits you, sometimes we go into like a fight or flight response, and that can be a really unhealthy place. That's a place where we shake our babies, and right, we have left our logical brain, so you're not making good choices anymore. So, you know, even though that anxiety was designed to motivate you, sometimes it doesn't. I often recommend to women, this is just a really easy hack: wear earplugs when your baby is crying like that. Stick those earplugs in your ears. You can still hear the baby cry, but it might, you know, lower the volume a little bit so that you can keep thinking logically during the time. Okay, what do I need to do to take care of the baby, instead of, why won't you be quiet? Ah, right? Which is kind of what happens when we go into that fight or flight response over the baby crying.
Mm-hmm. I think I'm really glad that you brought up anxiety, because I feel like that's a startling aspect of postpartum. I think you start to get a taste of it sometimes when you're pregnant, and all of a sudden you're worried constantly about this little thing in you. But then after, it's startling to feel those things and to be thinking constantly, is the baby okay? Have you done X, Y, and Z? If you like pass the baby off to somebody for a couple hours, you feel anxious. It's hard to get any relief.
Absolutely.
And how do you feel like sleep plays into this? Because I think that sleep deprivation makes it a whole lot harder.
Absolutely. Sleep deprivation is really, it's a torture technique that is used in wartime, right? I mean, it's really intense. And that is because sleep is a basic human need. So if you're not getting enough sleep, you are going to be going into that fight or flight response. You are not going to be in your logical brain again, and you're not going to be able to think clearly. So one of the first things I ask a woman who is postpartum is, how much sleep are you getting in a 24-hour period? If she tells me she's getting any less than 6 hours of broken sleep in that time, then I just go to problem solving. Like, what do we need to do to make sure you get more sleep? Because literally humans are not designed to function on less sleep than that. So you can't expect yourself to cope well if you're getting less than 6 hours of sleep in a 24-hour period. Once we get to 6 hours, it's still uncomfortable. It's still, you know, isn't going to feel great, but you can survive that, and you can, you know, make it through. And at that point, I think it's also really important to point out that insomnia is another defining factor of postpartum depression. So moving out of the baby blues into an actual diagnosis of postpartum depression, one of the first symptoms I usually hear from women is I can't sleep. Even when the baby sleeps, I just can't sleep. I'm totally exhausted and I cannot go to sleep. I don't know why. You know, it's normal to have sleep difficulties, one, because you're taking care of a baby who is up all the time, but also because we're just not trained to teach ourselves to just go to sleep whenever, right? You know, baby goes to sleep, it's 2 o'clock in the afternoon, and your body is like, what? I've never had to go to sleep at 2 o'clock in the afternoon. I don't know how to do that. So it takes some getting used to, for sure. And you can find, you know, that is a steep learning curve at times. But if you are not able to sleep at all, that is a big problem, and it might be a good reason to go see a professional. So that anxiety and that insomnia are the two defining factors that separate postpartum depression from major depression.
So major depression being not in the postpartum season, not
right.
like, yeah.
So for people who've been diagnosed with depression before, you can have a flare of that in the postpartum period that will look like postpartum depression, but oftentimes people will just develop a mood disorder during the postpartum period.
So then I think that's a perfect transition to talk about some of the things that you should seek help for. What are the defining like red flags maybe that women should keep an eye out for during that postpartum season, that it would be, I mean, because I just remember at your 6-week checkup, you get your little sheet that you circle the smiley faces or how often do you feel sad, and even in those moments you're not super sure that what you're feeling is normal or not normal. So what are some things that people should look for, and then how do they like take action on that, you know, if it's at week 3?
Yeah, absolutely. I think if you're in the first 2 weeks postpartum, I am not even allowed to diagnose you with postpartum depression. So often, again, 80% of people get baby blues. That doesn't mean you shouldn't go get some help. I have helped lots of women who are struggling with the baby blues on how to cope with that. And then, you know, they've come to see me once and that's it really, because then they got better. So do get help if you feel like you are not coping effectively with your life, period, right? However, I think the clues that you're having postpartum depression as opposed to baby blues, you know, besides insomnia and just feeling like your anxiety is out of control, is noticing that you feel disconnected from other people, including your baby. That's a big sign that we've gone into depression, that your brain is actually devoid of the chemicals you need to feel connected and joy. And then, you know, just the negative beliefs about yourself just starting to really rule you. Like, I'm a bad mom, up to and including, you know, people would be better off without me. My baby would be better off if I wasn't here, that kind of stuff. Any of those severe negative judgments on yourself, that's a pretty good indication that you're having depression.
And is depression, I don't know if this is too much of a rabbit hole, but is that something that's triggered by that physical change that sometimes for some people the cascade of hormones or the shift in everything sets that, or how does this happen?
It can be triggered by a lot of different things, really. Any major events can trigger depression. So all of that role transition stuff can trigger depression. All the physical changes to your body, just the sheer physical change that happens in having a baby and how severe that can be. Certainly anything that felt traumatic during childbirth can result in postpartum depression. I think there's just a ton of things that make it possible for anyone to get depression when they experience big changes like that. But on top of it, you have all of these hormones rushing through your body that make you more emotionally vulnerable. So I often think of it like this. Your body has to do all of this stuff to open wide to let a baby into the world. And your brain is doing the same thing. It's opening wide. And so what that means is that you are going to experience a heightened level of emotional vulnerability, which makes it even harder to cope with any of these changes that come up. So I definitely think there's a lot of different things that can trigger it. Also, if you had any kind of trauma in your past, oftentimes people will have trauma and then they will kind of heal from it to some extent. Like they'll figure out a way to cope with life and move on. But then they have these big events happen and little things get connected to past trauma that is stuck in different ways, and you might not have noticed it was stuck back there because you figured out how to cope with life. But then these other things happen and it snowballs. And now I cannot figure out how to cope. Things that I used to do to cope are not helping. And I'm really experiencing a lot of, re-experiencing symptoms of things that happened to me in the past, or, other ways that it gets stuck. I mean, even the way that we think about ourselves, sometimes those negative beliefs about ourselves will flare up around those snowballs. So I think that trauma is another thing that can be really tricky during the perinatal period. And let's face it, I mean, most of us have trauma. Maybe not big T trauma, but little t trauma certainly. And that's just intense stress. Right now, we're all going through a global trauma with this pandemic that people are experiencing. So, you have trauma. So if you're thinking, oh, this part doesn't apply to me, it totally does. I think also, anytime we experience stress in our childhood, it's harder for kids to deal with that and figure it out. And there's lots of little stuck points that people end up with from childhood. So finding ways to really reprocess some of that stuff with help from a therapist can really set you up. That's why they say the best thing you can do for your kids is heal yourself.
Yes, I think that's great advice. And so so some of the clues that what you're experiencing might be stepping into that postpartum depression would be the anxiety, to an extreme, the insomnia, the negative self, talk, the feelings of, you said one other thing. It was
emotional disconnection. From other people. This also includes just not feeling joy. Nothing really is making me happy at all, including my baby, right? I feel disconnected from other people, and I also just am not feeling joy at all. So oftentimes people will tell me, I'm not really eating that much because food doesn't sound good to me. I'm not really, I know I should shower, but I just don't feel like I want to. The chemicals that cause us to feel joy in our brains, right, the neurotransmitters, are also the ones that make us feel motivated to do life. So that lack of motivation to really engage in life functioning, including caring for your kids or smiling at your kid, that disconnect, it's all the same thing. So that sort of numb gray thing that happens is a really big part of it. Depression isn't really about sadness, although that can be part of it. I think it's really much more about numbness and lack of emotional connection.
That's a really great way that you described it, because we have an example, a woman shared her experience who had actually had 2 children prior, and then on her third experienced postpartum mood disorder, which she was not anticipating at all because it wasn't her first. She didn't have any postpartum mental health challenges after her first 2, but that was exactly how she described it. She had no motivation to do anything. And so that was some of her clues that she was just something wasn't right.
Right. And your brain tries to make sense out of it. So then that's where the negative self-judgment comes in. I think I'm just lazy. I'm no good. I'm a bad mom. Because you can't find the motivation to do these things that you should be doing. And it's really about chemical imbalance. It's not about who you are as a person.
And so then what would someone expect, especially if they've never seen a therapist before, and say they reach out to their doctor and say, I think I need to see a therapist, I might be having postpartum depression. What would that experience be like? Are they going to be talking? Are they going to be put on some sort of medication? I think a lot of women don't have an idea of what to expect.
I think all of those things are possible. So there's a bunch of different therapeutic modalities that are indicated for perinatal mood disorders. The one that I use most often is just CBT. We just work with your thoughts, your behaviors, and enhance your social support. so that you have some tools to cope with what's going on and to cope with your thoughts and to influence your own behaviors in order to get out of that place. As far as medication goes, that can be very helpful. I think medications can be tricky because nobody's going to do any experiments on pregnant ladies unless they have to. So really, we don't have enough evidence to definitively call any medications evidence-based for pregnancy or postpartum. And so a lot of women hear that and they go, whoa, no way, I'm not taking any antidepressants because they don't know if it's safe. And so, you know, that's understandable. It's a personal choice. I think the thing that you have to weigh, a lot of people consider one side of the seesaw, right? On the weight, they look at how medication might affect their baby or pass through their breast milk, that kind of stuff. And they don't consider the fact that how your depression is affecting your baby. So those are the things that you have to weigh, like how bad does it need to be for you in order to, that the risks over here are outweighed. And I would say if you're struggling with giving your baby the attention that they need in order to have a healthy foundation of their own brain development, then that's where you need to seek some help for sure. You know, again, it's very personal, so there's a lot of things that I could say here that really I don't want to give you an opinion about because I don't know you. I don't know who you are as a person. But if you can't look at your baby and smile and play with them, that is not good for their brain. That lays a foundation for an entire life of mental health struggles. So you've got to find a way to boost your own brain so that you can engage with them, or they're not going to be okay. So I think that that is one thing to look at. And, you know, so there's three categories. There's an A, B, and C category for medication. A is it's been studied and it is totally evidence-based that it's okay during pregnancy and breastfeeding. The second one is it has not been studied enough to definitively call it okay, but there's no indication there's a problem. There's tons of medication in this category. All of the SSRIs are in this category. Zoloft is the medication that's been studied the most, and there's no indication that there's any problem taking Zoloft during pregnancy or breastfeeding, that it really does not harm anybody. There's never been any reason for them to be concerned about it. And based on those studies, most obstetricians or midwives that you work with, most providers will want to start with that if you've never tried anything before. So yeah, a lot of women I see are on Zoloft, or a lot of people I see are on Zoloft. But, you know, I work with psychiatrists on my team who really take into consideration where you're at and what your self-determination is about it. They recommend supplements. There's lots of different things that you can do if you don't feel comfortable taking medication. And then the C category is it's been studied and it is not okay during pregnancy and postpartum. So there are definitely psychiatric medications that fall into that category. And if there's an indication that there's a problem, they're going to study that medication. And they're going to make sure to firmly stick it in the C category so everybody knows. There's still reasons why you might take medication in the C category if you're pregnant, because there are mental health struggles that are severe enough that they are bad enough for you and your baby that you need to not be struggling with that during pregnancy and postpartum. Things like bipolar disorder, although there's a couple of medications you can take with bipolar disorder that are totally safe during pregnancy, and like schizophrenia, things like that. So like some of the antipsychotics are in the C category, and there are reasons why you might want to not be psychotic while you're pregnant and having babies.
Yeah, it sounds like that seesaw that you were saying, depending on, you know, where you're at. So I guess my last question for you before we wrap up is if I gave you like a crystal ball and you could just like poof, you know, what you would like give every woman during this postpartum season to support her mental health and make those struggles a little bit easier, what would you do? Maybe it's stuff that already exists, and maybe it's stuff that you could just magic because you have your crystal ball.
Well, thank you. I like having a crystal ball. That's lovely. I actually run a group that is specifically for people who are concerned about postpartum mood disorders that teaches you how to influence your own thoughts, behaviors, and social support. It's called Beat the Blues. And it's for people who've never been diagnosed with anything, but they have risk factors. You know, hint, hint, we all have risk factors for postpartum mood disorders. So if I could give everybody something, it would be to go through that curriculum and learn how to influence your own thoughts, behaviors, and social support to make sure that you can, you know, maintain the healthiest mood you possibly can. I think that that curriculum should be taught in kindergarten, honestly. But
Is it
you know,
is it just in person or is it online too?
there's the curriculum I use comes from a program called Mothers and Babies, and it's free. You can download it.
Oh,
Um,
wow. Yeah.
yeah, it's really helpful to do with a group of other moms, but
Yep.
I highly recommend it. I think, you know, everybody should have access to this and be, you know, on point with this stuff for sure. Um,
That's awesome. I think that's really good, especially if people can access that curriculum for free. Would they need somebody? You said, I mean, obviously you guide your group through it, but could you go through it on your own and still get a lot of
oh
value
yeah.
out?
Oh, definitely.
Oh, that's
Yeah.
awesome.
I would say if you have any concern to get connected to a support person, like a therapist, if you have access to that, if that resource is, you know, if your insurance covers it, that kind of a thing, you know, just in case. I mean, again, birth is a thing that's, you know, unpredictable. A lot of things can happen, and a lot of those things can be triggering for us to struggle emotionally. Um,
Mhm.
I actually specialize in birth trauma. If I could do only one thing for the rest of my life, it would just be helping people heal from birth trauma. So there's really, really effective treatments for people who are struggling with birth trauma. So please, if you have any traumatic experience, it doesn't have to be like an actual medical emergency. You can just feel invalidated and not supported in your labor and delivery process and end up with trauma.
Mhm.
So if you have any struggles with what happens during your birth process, please get some help. There's really good stuff, and it doesn't take long to really help your brain heal from that.
Wow, that's amazing because I had never even thought about that being an important need, but it's obvious because so many women have those scars that they carry or those experiences that they almost can't even talk about. They're like, I'm not ready to talk about it yet because it was so traumatic.
Yeah, and every woman deserves to feel empowered like a superhero when after they have a baby, because you are. You made a human and birthed it. I don't care how that baby came out. That was you that did that. You created life. You're a superhero.
Mm-hmm. That's
And
wonderful. I think that's a perfect like way to wrap up too. I think that is a fantastic takeaway. It probably should be on a shirt.
for sure.